So sinusitis, what is it? It's inflammation of your mucosal lining in your sinus cavities. Basically, air-filled spaces, but now it's infected. So what are the symptoms you present with? The first thing that you're going to experience is facial pain. You're going to be experiencing fullness. Why is my head heavy? It might not be excruciating pain, but fullness with irritability sensation, especially to some when you bend down to pray. Then you feel the full force of the pain. You're like, oh, so now it's blocked and it's like your sink getting blocked. So a bit of the trickling of the pus and that thick, copious fluid starts to come out. So then when you feel that fluid coming out, you'll be experiencing nasal congestion. Nasal congestion, which will ultimately lead to nasal blockage, right? Because there's so much of thick, copious fluid filling up from the nasal cavity right to the back of your nose, which is called nasopharynx. So then that fluid, where does it go? Of course, to the back of your throat, right? So then you'll be feeling irritation plus postnasal drip, the persistent sensation of it going down. And because this fluid is infected, so when it goes down to your throat, to your pharynx and to your larynx, the infection can still go further down. So what you'll be having pharyngitis, you'll be having laryngitis. Some come to the extent of losing their voice or hoarseness, right? In children, it can lead to pneumonia too, because it goes down to your lungs. So those are the symptoms that you have from the nose going downwards. When it goes to the nasopharynx or the back of your throat, where else does it go? To your ears, right? So it goes to your ears and it can cause middle ear fluid effusion. So now you'll be having ear fullness too. In the acute stage, you might have or might not have fever. Usually you present with fever first, then these symptoms come in later. Or it can occur concurrently together. But usually most of us, after a few days, we do visit our GPs and so we are given antibiotics. So the fever settles. But these symptoms does not settle. The acute phase disappears. Still there's fullness. There's still the postnasal drip sensation. And sometimes when you talk, people perceive, oh, he smells. That's called halitosis. So then you have lower self-esteem, right? So when this nose is blocked at night, what do? When you sleep, you'll be having mouth breathing, right? So you tend to snore. Again, because we are not supposed to breathe through our mouth, because there's no natural humidifiers in your mouth, so you tend to have a dry throat in the morning. And you tend to clear your throat, which is referred to as hawking. So that act itself will cause even more pain to your throat.